Now we will discuss about ischiorectal fossa or ischioanal fossa. Since it is part of the perineum, let me tell you something about what are the different boundaries of perineum and what are the different subdivisions of perineum, so that you will get one idea, and from there we will take up our lecture. Actually, perineum is nothing but it is the region which is present in the lower part of the trunk and in between the two thighs. That means it is present in between the upper part of two thighs and at the lower part of trunk. That region what we are calling perineum. So that region we can better appreciate in the lithotomy position or when the limbs are abducted, right? So that diagram I will try to draw. In between the two thighs and at the lower part of trunk, this area is perineum, right? So let me draw vulva here. This is vulva. Here you can find clitorius. This is clitorius and urethral orifice, and here vaginal orifice. Here labia minora. Surrounding the labia minora, labia majora. External genitalia of female we will discuss in further sessions. At this session, remember that this is mons pubis, pubic hair, and this is vulva. Here anus. So here female in lithotomy position. Now we will try to draw male in lithotomy position. Here scrotum and penis. This is external urethral meatus. Here median raphe will be there. Here male in lithotomy position, right? Our definition of perineum is it is a region present at the lower part of the trunk and in between the two thighs. That means this area is perineum. Here this area is perineum. Now what are the boundaries of perineum? Here we have superficial boundaries and deep boundaries. Superficial boundaries means we can draw those boundaries over the skin surface itself. Deep boundaries means if you remove the superficial structures, we can see the bony and ligamentous structures. Those are deep boundaries that we will discuss. First, if we take superficial boundaries, anteriorly mons pubis. See, this is mons pubis. So anteriorly mons pubis, posteriorly buttocks. If you want to say exactly, upper part of natal cleft. Natal cleft means if you see the two buttocks, the upper part of the cleft. Actually here this is cleft in between the two buttocks. This upper part of the cleft which is present in between the two buttocks, right? So this point. That means here, this point posteriorly, otherwise simply remember buttocks, posteriorly buttocks. Then on either side, here what is there? Inner aspect of thigh. So here thighs, right? Now if you meet all these points, you will get diamond shaped area, is it? I am meeting all these points. This diamond shaped area is perineum. In case of males, anteriorly scrotum, posteriorly upper part of natal cleft or buttocks. On either side, inner surface of upper part of thighs. So this area is perineum. This is perineum. Here also diamond shaped area is there. Now if you divide this perineum into anterior part and posterior part, we can divide this into anterior urogenital triangle, posterior anal triangle. Because if you divide the diamond shaped area into anterior part and posterior part, we can see two triangles. Let me draw imaginary line. Actually that imaginary line passes anterior to the two ischial tuberosities. So if you meet these 2 points, we are dividing this perineum into anterior part and posterior part. Here also in the same manner we are dividing into anterior part and posterior part, right? Of course here anus, right? So this is perineum, superficial boundaries. Now we will take deep boundaries. Deep boundaries are equal to pelvic outlet boundaries. That means whatever the boundaries of pelvic outlet, those are only boundaries of deep boundaries of perineum. Let me draw that. Here, symphysis pubis and this is ischial tuberosity. Here, arteriolar foramen. This is conjoined ischiopubic ramus. This is also conjoined ischiopubic ramus. It forms the arch. That arch what we are calling pubic arch. So, anteriorly symphysis pubis. Let me draw cartilage here. Fibrocartilage. This is symphysis pubis. Actually, at the lower margin of symphysis pubis, we can form the ligament. What is that ligament? Arcade pubic ligament. Right? So, this is in the anterior part and anterolateral part. Posteriorly and posterolateral part. Here, this is coccyx. Tip of coccyx. Coccyx will be articulated with what? Apex of sacrum. So, this is sacrum. This is sacral hiatus. And here, dorsal sacral foramen. So, this is sacrum. There will be one ligament which is stretching from the sacrum to the ischial tuberosity. What is that ligament? Sacrotuberous ligament. What is it? Sacrotuberous ligament. So, this is sacrotuberous ligament. Here, we have drawn all deep boundaries of perineum. Anteriorly, symphysis pubis. Posteriorly, tip of the coccyx and sacrum. Anterolaterally, what is this? Conjoined ischiopubic ramus. Here also conjoined ischiopubic ramus. Then on either side, what is this? Ischial tuberosity. Then posterolaterally, what is this? This one and this one. Sacrotuberous ligament. Sacrotuberous ligament covered by gluteus maximus muscle. These are the boundaries. Recollect once again. Anteriorly symphysis pubis. Posteriorly tip of the coccyx and sacrum. Anterolaterally conjoined ischiopubic ramus on either side, posterolaterally sacrotuberous ligament on either side, laterally ischial tuberosity. Right? So, these are the boundaries. Now, we are dividing that perineum into anterior part and posterior part like this. So, we are making line from the anterior part of ischial tuberosity to the another anterior part of ischial tuberosity. Right? So, if you draw like that, we can divide this diamond shaped area into anterior part and posterior part. This anterior part what we are calling urogenital triangle, because that area contains urogenital openings and urogenital structures. Then behind this area contains anus. That's what this triangle what we are calling anal triangle. Right? Anus surrounded by anal sphincter. So, this is anal sphincter. This is anal sphincter. From the anus to the tip of coccyx, there will be one ligament. What is that ligament? Anococcygeal ligament. So, this is anococcygeal ligament. Right? About urogenital triangle, we will discuss in the next session. Now, we are concerning about this triangle. That means anal triangle. To discuss in detail about anal triangle, we have to take coronal section. That means we have to take section like this. Don't think it's a transverse section. Actually, if the person is in the lithotomy position, it will be looking like transverse section. But in anatomical position, if you take the section like this, this is coronal section at the level of anal triangle. So, that diagram I will try to draw here. And we will see what are the different boundaries and what are the different contents of ischiorectal fossa. Right? See here itself, few boundaries we can see here. In between the two conjoined ramus, there will be one membrane. That membrane what we are calling perineal membrane. So, here perineal membrane will be present. Right? So, where ischiorectal fossa is present? See, this is anus. On either side of the anal canal or surrounding the anal canal, there will be fossa. That fossa will be filled with fat and it acts as elastic cushion for the distinction of rectum and anal canal during defecation. So, on either side, there will be fat-filled space is there. That fat-filled space, what we are calling ischiorectal fossa or ischioanal fossa. So, here we can see some boundaries. If it is perineal membrane, if you see the boundaries of this space and this space, what we can say anterior boundary? Very simple. Anteriorly perineal membrane. Above the perineal membrane, one transverse muscle will be there. Below the perineal membrane, another transverse muscle will be there. Those are superficial transverse perineae and deep transverse perineae. Right? If you can remember those two muscles. Otherwise, simply remember anteriorly perineal membrane. That is sufficient. Then, posteriorly, what is this? Sacrotuberous ligament. That's it. Here, posteriorly sacrotuberous ligament. Now, laterally, what is there? Pelvic surface of ischium. Pelvic surface of ischium. Then, medially, what is there? Anal canal and wall of anal canal. That's it. Right? Then, what is present above? What is present below? Actually, perineum present below the pelvic diaphragm. Both urogenital region and anal region. Both are present below the pelvic diaphragm only. So, if you want to say superior boundary, what we can say? Pelvic diaphragm. So, superiorly pelvic diaphragm. Inferiorly, what is there? Skin only. Perianal skin. Inferiorly perianal skin. Recollect once again. Anteriorly perineal membrane. Posteriorly sacrotuberous ligament. Laterally pelvic surface of ischium. Medially anal canal and its wall. Right? Then superiorly pelvic diaphragm. Inferiorly perianal skin. These are brief boundaries. Now we will see what are the exact boundaries after taking the coronal section along the anal canal. Right? So, I am taking the section at this level and I am trying to draw here. So, this is section of ischium and here section of another ischium. Right? So, this is section of ischium. When you take the section at this level, we can see the coronal section of anus also. So, here I am drawing coronal section of anal canal. This is buttock. Here we can found anal columns. Here Hilton's line. So, this is anal canal. Right? Now, this is pelvic surface of ischium. Pelvic surface of ischium and obturator membrane gives origin to one muscle. What is that muscle? Obturator internus. So, this is obturator internus. So, here also this is obturator internus. Obturator internus muscle covered by membrane. What is that membrane? Obturator fascia. What is it? Obturator fascia. Fascia covering the obturator internus. What we are calling? Obturator fascia. This is the fossa present in between the ischium and anus. So, this fossa what we are calling? Ischioanal fossa. Right? So, here we have lateral boundary, medial boundary. Right? And floor also we have. This is floor or base. It is formed by perianal skin. Then where is roof? Roof is formed by pelvic diaphragm. Here, one muscle taking origin from the obturator fascia. That muscle what we are calling? Levator ani muscle. So, here levator ani. So, this is levator ani muscle. Here also, this is levator ani muscle. This levator ani muscle lined by another membrane. What is this membrane? What I am drawing here? This is anal fascia. So, this is obturator fascia and this is anal fascia. Right? Now, we have to draw few more structures which are related with the anal canal. Actually, GIT contains muscular coat, inner circular, outer longitudinal coat. Is it? Now, I am drawing those coats, inner circular coat and outer longitudinal coat. Then we will discuss about levator ani muscle. First, if we take inner coat, what is that inner coat? Inner circular layer. That inner circular layer in the lower part, it becomes sphincter. So what is the sphincter? See here, in the lower part it is thickened and forms sphincter. This sphincter what we are calling internal anal sphincter. So surrounding the lower part of anal canal, there will be internal anal sphincter. So internal anal sphincter is formed by circular smooth muscle fibers. So this is internal anal sphincter, right? Then after circular muscle coat, there should be longitudinal muscle coat also, is it or not? So here I am drawing longitudinal muscle coat. This longitudinal muscular coat fuses with puborectalis at the level of anorectal junction. At the level of anorectal junction, that means somewhere here, this longitudinal coat fuses with anorectalis muscle. If you trace it down, this longitudinal coat becomes fibroelastic septum. Actually, this longitudinal coat, what we are calling conjoined longitudinal coat, because it is formed by union of puborectalis and longitudinal muscle coat of rectum and anal canal. So this is conjoined longitudinal coat. If you trace this longitudinal coat downwards, it divides into so many fibroelastic septum. So it divides into so many fibroelastic septa. These fibroelastic septa attaches to perianal skin. So it attaches to perianal skin. Actually, it pierces the external anal sphincter, that I will tell you. So if you trace this longitudinal coat, it divides into so many fibrous bands or fibrous septa. Those septa will be attaching to the perianal skin. In these septa, two septa are more important. One septum is going to the medial side, that means medialmost septum, and another septum is lateralmost septum. Medialmost septum attaches to the anal wall at the level of Hilton's line. See, this is Hilton's line, right? So this septum, what we are calling anal intermuscular septum. So this is anal intermuscular septum. Then lateralmost septum is there, no? This is lateralmost septum. This lateralmost septum, what we are calling perianal fascia. This is very important here, because it is dividing the ischiorectal fossa into upper part and lower part. So what is this? Perianal fascia. Let me draw here also. This is longitudinal muscle coat of rectum and anal canal. After uniting with puborectalis, it forms conjoined longitudinal coat. This conjoined longitudinal coat, if you trace it down, it divides into so many fibroelastic septa. Those fibroelastic septa attaches to the perianal skin. In these septa, two septa are important. One is medialmost one, that will be attaching to the anal wall at the level of Hilton's line. That septum what we are calling anal intermuscular septum, and one more septum going laterally, or it is lateralmost septum. This septum what we are calling perianal fascia, right? Then after that, there is internal anal sphincter. There should be external anal sphincter also. So here external anal sphincter is present here. External anal sphincter divides into three parts: deep part, superficial part and subcutaneous part. So here deep part, this is deep part of external anal sphincter. This is superficial part of external anal sphincter. Here is subcutaneous part of external anal sphincter. So this is subcutaneous part of external anal sphincter. This subcutaneous part of external anal sphincter pierced by conjoined longitudinal coat. That means this is conjoined longitudinal coat. It pierces the subcutaneous anal sphincter, right? Actually, external anal sphincter divided into deep, superficial and subcutaneous part, right? So, this subcutaneous part pierced by conjoined longitudinal cord, right? Because this conjoined longitudinal cord in the lower part, it is dividing into different fibroelastic septa, those fibroelastic septa piercing this subcutaneous external anal sphincter, and they attach to the perianal skin, right? So, this is about external anal sphincter and longitudinal muscle cord. Now, we will see one more fascia which is lining the ischiorectal fossa. What is that? Fascia lunata or lunate fascia, which lines the operator fascia and anal fascia, right? So, in the lower part, it fuses with periosteum of ischial tuberosity, then it lines the, what is this? Operator fascia, then it lines the anal fascia, and it fuses with the anal fascia at the level of Hilton's line. Actually, anal fascia will be coming like this. I didn't draw because it will disturb. It will fuses with the anal fascia at the level of Hilton's line. If you want to draw, you can draw like this. So, lunate fascia fuses with anal fascia at the level of Hilton's line. See here, this is highest point or summit of the lunate fascia. The summit of lunate fascia, what we are calling tegmentum. What is this? This is tegmentum. See, this is highest point of lunate fascia. This highest point or summit of lunate fascia, what we are calling tegmentum. Remember that, because we are going to divide the ischiorectal fossa into different parts, right? In that, it will be helpful. If you want to draw this lunate fascia here also, we can draw like this. This is ischiorectal fossa or ischioanal fossa. Now, we have to tell something about this canal. What is this canal? This one and this one. Alcock's canal. Alcock's canal is fibrous tunnel. That means there will be fibrous canal. Through that fibrous canal, some structures are passing. What are those? Internal pudendal vessels and pudendal nerve. Actually, at the posterior part of this canal, internal pudendal vessels and pudendal nerve divides into branches. So, at this level, we can see the branches of those vessels and nerves, right? Let me tell you, but you remember strongly that through this pudendal canal, pudendal nerve and internal pudendal vessels are passing. You remember that strongly. But at this level, what are the structures passing through this canal? Actually, pudendal nerve divides into mainly two branches. What are those? This is dorsal nerve of penis and this is perineal nerve, right? So, those two structures we can see here. This is dorsal nerve of penis or dorsal nerve of clitoris in case of females, and this is perineal nerve. In between these two structures, there will be passage of internal pudendal artery along with vein. So, here internal pudendal artery and here veins. So, same structures we can draw here also. Dorsal nerve of penis, perineal nerve, pudendal vessels. Now, from the pudendal nerve and internal pudendal vessels, there will be one nerve from the pudendal nerve, artery from the internal pudendal artery, supplying to the external anal sphincter and the perianal skin. What is that nerve? Nerve is inferior rectal nerve and artery inferior rectal artery. Inferior rectal nerve and inferior rectal artery. That means inferior rectal vessels and nerve crossing ischiorectal fossa from lateral to medial side. Is it? So, within this fossa, fatty tissue is there, right? So, through that fibrofatty tissue, these structures are passing. What are these structures? Inferior rectal vessels and nerves. So, inferior rectal vessels and nerves are passing from lateral to medial side to supply the external anal sphincter and perianal skin. This is the orientation about the ischiorectal fossa. Now we will see what are the boundaries and contents of ischiorectal fossa. Now we will see the boundaries. Anteriorly perineal membrane, posteriorly sacrotuberous ligament and covering gluteus maximus. Then laterally operator internus and fascia covering the operator internus. Right? Within the lateral wall, we can see the pudendal canal. Clear? Then medial wall. See, lateral wall is vertical. Medial wall is sloping downwards and medially. See, this is medial wall. Totally, this is medial wall. This medial wall is sloping downwards and medially. Is it? So, medial wall is formed by levator ani and anal fascia. Levator ani and anal fascia. Then, external anal sphincter. So, these are the medial boundaries. Very simple. Lateral boundary, operator internus and fascia covering the operator internus. Medial boundary is formed by levator ani, external anal sphincter and anal fascia. Then, actually this is wedge shaped. Is it or not? It is like a triangular. So, if it is wedge shaped, it is having the base and apex. So, this is base. This is apex. Base is formed by perianal skin. So, base is formed by skin. Apex is formed at the fusion of operator fascia and anal fascia. See here, this is operator fascia and this is anal fascia. These two are meeting here at this level. So, this is apex. Clear? These are the boundaries. Very simple. Anteriorly perineal membrane, posteriorly sacrotuberous ligament and covering gluteus maximus. Medially by levator ani, external anal sphincter and anal fascia. Laterally operator fascia and operator muscle. Apex is formed at the fusion point of operator fascia and anal fascia. Base is formed by perianal skin. Then we will see the measurements. Anterior-posterior diameter, transverse diameter and vertical diameter. Vertical diameter and anterior-posterior diameter is 5 centimeters only. But transverse diameter 2.5 centimeters. Now we will see extensions. That means anterior extension, posterior extension. These extensions what we are calling recesses. Anterior extension is anterior recess. Posterior extension is posterior recess. So we have anterior and posterior recesses. That means this is ischiorectal fossa. Ischiorectal fossa anteriorly extends forwards up to the posterior surface of body of the pubis. Ischiorectal fossa extends forwards over the deep perineal pouch. Okay, what is deep perineal pouch? We will see in the next session. But at this session, remember that above the deep perineal pouch, ischiorectal fossa extends forwards and reaches up to the posterior surface of body of pubis. It is having posterior extension also. Posteriorly, it extends backwards along the side of coccyx, in between the sacrotuberous ligament and sacrospinous ligament. Very simple. It is having two extensions. Anteriorly, it is extending forwards. Posteriorly, it is extending backwards. Anterior extension is along the ischiopubic ramus, extends up to the posterior surface of body of pubis. That extension will be passing over the deep perineal pouch. Then posterior extension. Posteriorly extends backwards along the sides of coccyx, in between the sacrotuberous ligament and sacrospinous ligament. Right? Then we will see different subdivisions. What are the different subdivisions of ischiorectal fossa? See here, this is tegmentum. We know that this is tegmentum. Above the tegmentum, here some space is there. That means in between the tegmentum and operator fascia laterally and anal fascia medially. Here one space is there. This space what we are calling suprategmental space. This suprategmental space filled with liquid fat. That's it. Then here in between the lunate fascia and the perianal fascia, here this space is there. Actually this space is ischioanal space. Ischiorectal fossa means total we are calling as ischiorectal fossa. But ischioanal space or ischiorectal space is nothing but the space which is present in between the lunate fascia above, perianal fascia below. That means this area only ischioanal space. Then in between the skin and what is this? Perianal fascia. This area what we are calling perianal space. This is perianal space. This is ischiorectal space and this is suprategmental space. Right? Then there will be horseshoe shaped space here. Behind the anus, there will be horseshoe shaped space which is communicating the one ischiorectal space to the another ischiorectal space, right? So that is horseshoe shaped communication between the two ischioanal spaces. So these are the different subdivisions. Recollect once again. Above the tegment, suprategmental space, in between the lunate fascia and perianal fascia, ischioanal space, in between the perianal skin and perianal fascia, this space, perianal space. Then there will be horseshoe shaped space connecting one ischiorectal space to the another ischiorectal space. That space what we are calling retroanal space, right? So these are the different subdivisions of ischioanal fossa. Now we will see what are the contents of it. Almost all contents we have discussed, but specifically we have to define what are the structures which are present in the ischiorectal fossa. See here, what are these? Internal pudendal vessels and pudendal nerve. Is it? So those are present in the lateral wall of ischiorectal fossa. Then what are these? Inferior rectal vessels and nerves crossing the ischiorectal fossa from lateral to medial side, right? So these are the second structures. Then here posterior scrotal vessels and nerves. Posterior scrotal vessels and nerves are posterior labial vessels and nerves. In case of females, posterior labial vessels and nerves. In case of males, posterior scrotal vessels and nerves. They are entering into the urogenital triangle from the anterior part of ischiorectal fossa, right? So what are these structures? Posterior scrotal vessels and nerves. Then here perineal branch from the S4, that means perineal branch from the fourth sacral nerve. So this is perineal branch from the fourth sacral nerve. It is also one of the content of ischiorectal fossa. Then there will be perforating branches from the S2, S3. Perforating branches from the S2, S3. Right? So these are the contents of ischiorectal fossa. Recollect once again. Internal pudendal vessels and nerves in the pudendal canal or Alcock's canal. Then inferior rectal vessels and nerves. Of course, these inferior rectal vessels and nerves are branches from the pudendal nerve and internal pudendal vessels only, right? But these structures are crossing from lateral to medial side. Clear? Then at the anterior part, posterior scrotal vessels and nerves are passing into the urogenital triangle from the anterior part of ischiorectal fossa. Then perineal branch from the S4, perforating branches from the S2, S3, and it is filled with fibrofatty tissue. Clear? So these are the structures which are present in the ischiorectal fossa. Now we will see applied aspects. See here, this is levator ani muscle. This levator ani muscle taking origin from the obturator fascia. If it is not taking origin from the obturator fascia, that means if it fails to take origin from the obturator fascia, what will happen here? There will be gap. Is it? So this gap, what we are calling hiatus of schwalbe. Hiatus of schwalbe. Hiatus of schwalbe. So if levator ani muscle fails to take origin from the obturator fascia, that condition what we are calling hiatus of schwalbe. So if there is hiatus of schwalbe, hiatus means opening. See here, there is communication from the pelvic cavity to the ischiorectal fossa. So pelvic contents, the contents which are present in the pelvis may herniate into the ischiorectal fossa. Set. So that is one condition. Then as we know that this is ischiorectal fossa filled with fat. Actually fibrofatty tissue, predominantly fibrous, and it is having very poor blood supply. That's what it may infect and produces abscess. That abscess what we are calling ischiorectal abscess, right? this ischiorectal abscess is less painful than the abscess which will be formed in the perianal space. Actually, in the perianal space, see this is perianal space. This perianal space present in between the perianal fascia and perianal skin, and it is divided into so many small compartments. Those compartments are filled with fat, right? If there is infection in this space, there will be accumulation of pus or abscess which increases the tension. Why? Fat is present in the tight compartments. That's what there will be increased tension which leads to tremendous pain. That means too much pain, because these compartments are very tightly packed, right? Sometimes they may burst over the surface of the skin. But if there is accumulation of pus or abscess in the ischiorectal space, patient feels less pain than the perianal abscess, because fat which is present in this space is not tightly packed, right? Then patient feels less pain only, but there will be tenderness and fullness in between the anus and ischial tuberosity. Sometimes this abscess may burst into the anal canal. The abscess which is present here, it may burst into the anal canal. That condition what we are calling fistula in ano. Fistula in ano. Sometimes this fistula or that fistula's tract, it may open or it may burst through the perianal skin. Then if there is infection in this space, it may spread to this space also. How? There is a communication or horseshoe-shaped communication behind the anal canal. Through this communication, infection or abscess may spread to this space also. Is it? So, these are the few applied aspects related to ischiorectal fossa. I hope you understood. That's it for this session.